Hello and welcome to yet another edition of the Dental Podcast. Proudly brought to you by Rela Dental, your dental experts. This is Smile for Miles. And today we are going to talk about one of the leading causes of tooth loss in adults. Do you know what that is? Gum disease. And to take us through, we have Edward, Eddie, the smile artist. Can you imagine that? We love the smile artist. And we have Dr. Francis Lakor, our senior consultant, oral and maxillofacial surgeon. We hear that quality of people that I have. On one hand, the smile artist. On the other hand, a senior maxillofacial surgeon to tell us more about gum disease. What do you need to know? But to get to that, let's first have AB explain to us what is gum disease.
Well, thank you so much, Livia. Gum disease is an infection that affects the surrounding parts of your tooth, the tissues. It affects the tissues that support your tooth, and it can start when plaque is a thin layer of bacteria that it's a thin layer of bacteria, and it gets deposited on your tooth and along the gum line. So when you look at gum diseases, there are mainly two stages of gum diseases. So the first one, we have the early stage. We also call it gingivitis. Then we have the other one, which is advanced stage. So also known as periodontitis in the other language. So on the early stage, here you find the gum is red, swollen, and bleeding. And this one can be reversed by home oral hygiene. If you take it seriously, you can reverse it if we detect it earlier. So on the other hand, the other second stage, the advanced stage, also called periodontitis, is when an infection spreads deeper into the bone and the supporting structures of the tooth. So this one, you may need a dentist maybe to do deep cleaning on it and to give you some medications if it's necessary. Yes.
I want to know more about what called this gum disease.
The causes of gum diseases are this: if you mainly don't brush your teeth, you can get gum diseases. Then we have infections.
So wait, if you don't brush, so if I brush daily, okay, I can't get gum disease.
If you brush daily in an appropriate way, you can't get it. Yes, so if you don't brush, you're putting yourself at a high risk of getting gum diseases. Yes.
You are still saying that once causes gum disease, apart from not brushing appropriately. Brushing appropriately means that you brush twice a day, you brush using the right toothpaste, you also brush, you don't just quarter brushing.
Yes.
You say you brush at least for 2 minutes. You can do more by the way, but at least for 2 minutes, 2 times a day. Do it well, do it perfect. That means that you reduce the risk of getting gum disease. But our smile artist is being sure more about the causes.
Yes. Then the other causes, we have smoking or use of tobacco. Yes. Then we have mainly the risk factors.
But before you go to the risk factors, can we know the early signs? Because in my understanding of dental issues, I know that bleeding gums are appropriate. If the moment you see bleeding gums, that's a sign that there's a problem
Yes.
with your teeth or dental system. what are the signs that we should look out for?
So we have other signs you should look out for. Number one, when your gums are bleeding when brushing, yes, you may find that a normal gum should not bleed when you're brushing. Then the other thing is when you see your teeth, your gums are shifting down, we call it receding down. Yes, when your gums recede down, you may see your teeth look taller as not as usual. Yes, then when you see your teeth shifting or drifting, it means you have gum diseases. So a tooth to shift, it maybe needs braces to pull the tooth, but when it pulls itself, it means you have the signs of gum diseases. Then when you have pain on the gums, yeah, that one also indicates that you have a problem with your gums. Yes.
And when the teeth shake, that's okay?
Not really. It means the tissues supporting that tooth are destroyed or affected. So it makes the tooth to become loose. Yeah.
You were talking about the risk factors. I see here on the screen. Okay, this is early warning sign. We were talking about bleeding gums when brushing or flossing, red, swollen or tender gums, bad breath. You haven't talked about bad breath. Some detail on that. Loose or shifting teeth, gums pulling away from the teeth, making them look longer, which you have explained. But I'm seeing bad breath that doesn't go away.
Yes. So when you realize that you have bad breath, okay, there are some bad breath that can go away after a small period of time when you do something, cleaning, brushing. But if you get that one, that doesn't go away. It's consistent. It means your gums are affected. Maybe there is a wound which is not healing there, so it needs to be given attention. Yes.
So who is at risk?
So everyone can get gum diseases, but people at risk of getting gum diseases are people who don't brush daily. Then we have smokers, those people who use tobacco, smoking. Yeah. Then we have those ones. Okay, there is even people with hormonal changes. Take, for example, those pregnant mothers. They get those hormonal changes during pregnancy.
And people with non-communicable diseases like diabetes?
Yes, people with diabetes also are at a high risk. More so, especially when the diabetes is not controlled. Yes.
I'll move to Dr. Lakor. Dr. Francis Lakor. Why is gum disease danger?
Thank you, Sylvia. Gum disease, as you already heard from my colleague, can be dangerous. It can be dangerous if it is not the tooth or the gum is not taken care of. I just begin by what example he has given. How about pregnant women? Pregnant ladies, rather. You see, many people don't understand the fact that a bad bleeding gum can lead to miscarriage. These are the fact that the population out there don't know. And we want to bring it out very clearly. Our body is interconnected. The blood supply is interconnected, including the gum. You would imagine an infected gum bleeding gum with infection. The blood flows to the bloodstream. And when it flows to the bloodstream, it reaches the placenta. It produces chemicals. That chemical which can cause contraction of the uterus wall. Hence, a pregnant lady can get miscarriage. So many patients or many people outside there don't know that actually it is important to visit a dentist in order to have an healthy child, because you end up either one, having miscarriage, two, a child with a low birth rate, birth weight. That's number one. That's the danger in as far as the pregnant women is concerned. Number two, as I alluded to in the other previous discussion, formation of abscess. The abscess can be formed because of the bacterial infection. The abscess can be formed along the gum, and we call it a periodontal abscess on the gum. And this abscess can track similar way like dental infection tracks through our spaces, goes and can even cause death. That is gum disease, which can be fatal. We are talking of heart disease. We are talking of kidney disease. We are talking of liver disease. All those, we are talking of cancer of the esophagus and the cancer of the intestine and the rectum. There is clear scientific evidence that all those organs I've mentioned has a relationship with the infection from the gum, including the heart disease. The bloodstream that comes through the gum goes to our vessels and destroy the vessel wall. Hence, it aids formation of cholesterol, and you know what it does. So those are the area where the danger comes from gum bleeding or infection of the gum.
So according to that explanation we are basing on Dr. Lakor, I think I have started fearing gum disease even more, because a pregnant woman is at risk of even losing the child or dying, because you mentioned it can leak it. You're at risk of losing your teeth. I know by getting kisaki when you leak your teeth.
But there are options we could talk about when we come to those at a later stage.
But you are at risk of losing your teeth. He talks about the liver, he talked about the heart. Basically, all those organs in our bodies are at a very high risk if you do not take care about that. That is when I got from the explanation. But Dr. Francis, is there a way
People can survive gum disease?
Oh yes, there are ways we can survive gum diseases. Because to survive, you have to know what causes it. We know the causes of the gum disease is a plague which form around the tooth, and the bacteria feeds on it, and then it causes, they produce a substance which destroy the gum, hence the bleeding of the gum. What do you do? Regular cleaning of the teeth. I've already talked about other disease condition. We need to adopt a healthy lifestyle, including what we eat, because there are other conditions which are two directional, like for example liver and kidney. They have two. Liver disease can cause gum disease and vice versa. So you can imagine what effect it does. Liver is the most important organ we have in our body. It cleans, is the where a purification of our blood system takes place. So if it is sick, you know what it is. Heart is the one pumping the blood. If it is affected, you know what happened. Kidney, if it is affected, all the blood substance that's supposed to be excreted cannot. In nutshell, gum disease can lead to effect on all these organs. And research has actually shown that people with healthy gum live longer. Yes.
So keep your gum healthy.
Yes.
Live long.
Yes. People with healthy gum from childhood onwards live longer than the people with affected gum. Because you avoid all these other diseases. I'm not saying it's the singular reason for cause of those diseases, but the research has shown that is one of the factors. It'll be one of the biggest contribution to that.
Okay, so what treatment options are available for people who are suffering from rounding, starting from the condition that you talked about, the two gingivitis.
Gingivitis.
Yeah, that's the infection of the gum.
That is
So what treatment options are available?
Well, the treatment option which is available, first of all, when we know the stages, that is important. That we, apart from cleaning the teeth, we have mouth washes which we can use. If it reaches advanced stages where there is infection, you have to give antibiotics. And to reduce the inflammation, you give analgesics. And a regular checkup to the dentist. And of course, as I said already, a healthy lifestyle. Because if you take enough vitamins, you take enough fruits and then you will keep your gum clean and you avoid that. Yeah, all what I'm saying are already complication at advanced stage. You avoid reaching that advanced stage. Hence, you can avoid all those.
When we get to the advanced state, it means we can go for surgery.
Well, surgery is in some instance when the pocket of the gum is so deep that food goes, and after cleaning, what we call scaling and polishing, cleaning, the pocket still remain. So a dentist is called periodontologist. It is a specialist that handle the treatment of the gum. They go and then reduce the pocket such that the gum heals back to normal. That one can be done. Yes, by dentists.
I'm back to the smile artist, and I want him to take us through some of the myths. I know that some people think that when you see bleeding gums, it's because you're not using the right toothbrush, brushing so hard. Can you throw some light on that?
Yes, in some cases, when someone uses a hard brush and applies a lot of force, your gums will eventually bleed. Yes, but yeah, they are right when they see the blood after brushing. That factor might be the one causing the bleeding. Too much force and using a hard brush. So you should also use a soft brush and don't be so rough with your mouth. Yes.
Don't be so rough with your mouth
when you're brushing.
Okay. I wanted that to come out so clear. Please be gentle while brushing your teeth. Last week, the stations told us that the mouth is the gateway to your health.
Yes. And it's the mirror. It's the mirror of your code.
If the mouth is the mirror, kiss the gentle. Be kind, sweet. Use appropriate toothbrush and toothpaste and do it right. Make sure that your oral hygiene gives you long life, because we have heard from Dr. Lakor that people with healthy gums live longer. If you want to live longer, you're going to take good care of your oral hygiene. We have explored a number of issues. One of them is gum disease. I'm sure by now we know what gum disease is. We also know how it develops. We know the dangers, and we also know how to avoid it. And the treatment options are available for gum disease. Doctor, is there anything else you want to tell our viewers?
Well, I think the only thing I need to tell the viewers is adopting healthy lifestyle, number one. Number two, regular checkup to the dentist. If you see that you are bleeding after brushing, you need to get to the dentist and know why you are bleeding. So regular checkup is the key. Yes.
Okay. I'm the smile artist to tell us something about how we can keep our smiles in perfect shape.
Yes. Gum disease is common, but you don't need to ignore it. Bleeding gums is not normal. So when you realize that you have bleeding gums, you should at least go and see a dentist, seek for medical advice. Yes. So, but don't again try again being other things. It might worsen. So I advise you to go and see a specialist who can advise you to do something. Okay, who can do something good, and you'll be okay. Yeah.
Because all hope is not lost the moment you see a bleeding gum. It's not normal, but it can be fixed. And we are here to make you smile for miles, because we care for your smiles. When you walk into Rela Dental, you will see something that says, "We love to see you smile." You will not smile with a bleeding gum. And that's it for today. Follow us on social media, on TikTok, on Facebook, on X, and very soon on YouTube, for everything you need to know about your dental system.